Good evening, everybody, and welcome into your virtual program with the Schaumburg Library. My name is Chris. I'm your adult programs coordinator at the library, and I am so excited to be spending this evening with you as we continue along on our second Tuesday evening series with the League of Women Voters of the Palatine Area. Tonight's topic is, there's the league president. Tonight's topic is focusing on your municipality and mental health in honor of Mental Health Awareness Month this May. Just before I hand things over to the league formally, just a few of our friendly Zoom reminders. Please remember that your cameras and microphones have been turned off. So if you have any questions for this evening's speakers, please feel free to put those in the Q&A. We'll address questions as we go a little bit, but primarily save them for the end of the presentation. You'll also notice that we have closed captions turned on for your convenience. If at any point this evening you are experiencing technical difficulties, please make sure to once again use the Q&A button in order to reach out directly to me. I'll be monitoring the Q&A for any tech issues, and if you use the Q&A, I'll be able to go back and forth with you more smoothly to fix any issues you may be having. Now this evening, I'm going to pass it over to our friends at the Palatine League. Oh, Janet, I asked you pronounce your last name, and here I am forgetting it. Janet Sanoika.
You got it in one.
Oh, I did it. Success. You can all go home, everybody. The program's over. I said Janet's last name right. Janet, the evening is yours, and everybody, I look forward to seeing you. I'm going to really smoothly flip this so you guys can experience the wonder, grace, and beauty that is tonight's speakers. Janet, take it away.
Will do. Thanks so much, Chris. Yeah, as Chris mentioned, this is a continuation of our Civic Series Awareness, between the League of Women Voters of Palatine, which serves the multiple areas, including Barrington, Hoffman Estates, Inverness, Palatine, Rolling Meadows, and Schaumburg. This is our ongoing series. Thank you so much for joining us this time. As Chris mentioned, it is Mental Health Awareness Month, so that will be our focus today. Quick before we start, I just want to turn it over to our President Kathy Cortez to see if she has any league announcements that she would like to share with us before we get started. Oh, you're muted. Yep.
Just a very big welcome to both our presenters and guests this evening, and a thank you to the Schaumburg Library for always putting these on. So enjoy. This is a really important topic, and I appreciate everyone's interest in it.
Great, thanks so much. So yes, for those who have not read the blurb, today we are speaking to members of the Township of Schaumburg Mental Health Board. We have the President, Bob Ogilvie, as well as their Executive Director, Quinette Hobson-Robb. Bob and Quinette, if you'd like to give a brief intro on yourselves and a little bit of a background on the Schaumburg Mental Health Board.
I'll start, if that's okay.
Yes.
So Mental Health Board in Schaumburg Township is a fairly new development. However, in the state of Illinois and other parts in the country, it's a 60-year-old entity. In 1963, Washington had a really good idea, and they were wanting to see mental health treatments moved away from large institutions. They wanted to see people with developmental disabilities moved away from large institutions. So they passed the Community Mental Health Act and more or less mandated that the states move out of those type places and provide in-community housing and in-community mental health care. And there was just one little thing they forgot to do. They didn't fund it. And Washington, I think, to this point, has never funded it. So states, including ours of Illinois, legislature got involved early on and decided that the only way this was going to work was to have funding done at the local level. So many governmental bodies in Illinois, some villages, some counties, some townships formed what were called 708 boards, which refers to the legislation that the House enacted, which is Illinois House HR 708. So some are called 708 boards, some are called mental health boards, some are called community health boards. It's all the same thing. And these boards, our board, have a taxing authority. and that is a result of a referendum that the voters agreed to accept a small property tax increase to provide funds for us to grant money to agencies that could take care of people in 3 different categories. And there's some overlap in the categories as well. But the basic categories are mental health, developmental disabilities, and substance use disorders. So nonprofits that address those issues can apply for funding from us. The way it happened is we are volunteers, board members are volunteers. We were appointed by the township trustee, and I want to take a little sidestep here and give a little lesson on townships, because there's always confusion about this topic. So I don't want to lose anybody that thinks we're not speaking to you. But Schaumburg Township is not just people that live in the village of Schaumburg. 7 different villages make up Schaumburg Township. The village of Schaumburg in its entirety is in the township, but then around the outside edges and a pretty good chunk from one direction, Hoffman Estates, but there's Rolling Meadows, Elk Grove, the Cook County part of Roselle, part of Hanover Park, part of Stringwood, Schaumburg, and Hoffman Estates together make up Schaumburg Township. So if I use the word Schaumburg, it's just because it's the way it's rolling off my tongue here. If I forget to say township, but don't tune us out because you live in one of these other pieces of our township, because this is for everybody. The township is just sort of a rectangle on the map, and it's different than the very unusual borders that the villages have. It's just a box. So about 3 years ago, people that wanted to see this happen in our township stood in front of this library, went to other civic events, got petitions signed, and got a ballot initiative, which also, it can be referred to as a referendum, on the ballot in the fall, 1.5 years ago. And it was overwhelmingly passed. And then subsequently, that was in November, February of 2023, the board was officially formed. Applications came from residents to be part of the board, and the township supervisor appointed the original 7 members of the board. Unfortunately, one of our members passed away about a month ago, and we have a new member, but we're still a board of 7. And like I said, we're volunteers. We do now have staff, and our entire staff is sitting next to me. And we are thrilled that Quinette joined us. She has previous experience with a very large mental health board in the state, which is invaluable to us. And she's a military veteran and just really an asset to us. So we're proud to have her. And I think she's going to add a lot to this conversation when you get done listening to me. So that was sort of how it came to be, and sort of how we're funded. And the reason I sort of emphasize the staff of 1 is our overhead is not really great. So we are able to use most of those tax dollars, the majority, for grant funding, which is great. I like that it worked out that way. I hope never in the future we get to be top heavy where tax dollars are not providing services. We currently are officing in the township building, and hopefully that's where we'll remain. So it's a good setup for us at this point. We've had full support from the township trustees, and it's been a real pleasure so far for us to participate in this. The first year, we were kind of feeling our way through because even though we had healthcare professionals on the board, there wasn't a lot of board experience on the board of any other sorts, or governmental experience for that matter. So it's been a big learning curve, and now we're blessed with a professional that is helping us navigate through what we didn't know. So thanks for that. So the agencies that we took funding requests from agencies last fall, and we just made funding grants in March, and we're just getting started with payments, and they're a very diverse variety of nonprofits, and one of our goals was to try to not duplicate services, and I think we're off to a good start with that. Some do similar things, but not exactly the same things. Our sort of charge by legislation is to fill in gaps. We're supposed to see to it that people who might otherwise be not getting the care that they need for a whole variety of reasons. We did a needs assessment that brought a lot of these reasons to light. And the obvious one is money, but it goes way beyond that. There are cultural reasons why some citizens don't seek help for mental health issues, and we're trying to figure all that out. You know, how do we get through to people that have a stigma in their family or their culture that mental health issues are not any, they're not uncommon. They're everywhere. I think every family, everyone's workplace, everyone's acquaintances, there's a person in there somewhere that's struggling with some treatable mental health issue, and we want to get the word out that we had an event last week here at the library, Minds Matter, in conjunction with the library. They hosted it for us, and it was a community event to get the word out. It was really interesting because the township has had that event at the township building before the mental health board ever existed. It's gone on for probably at least a dozen years. And generally, the people that attended were there on purpose. They kind of, saw it in the township publication or something, and they showed up on purpose. But because it was at the library this time, people were just coming through the door in their normal course of taking their kids to the library or coming in to get books or movies or whatever. And boom, here's all these tables set up and this crowd of people. And they're like, what's going on? What's this about? So it was really easy to start conversations with people about, we're all about mental health, and right here in your township and at your library, which is, the educational center of the whole township, is putting on this so you can know about it. Just like this event that we're doing right now, this wonderful education. So the Minds Matter event that we had was a huge success. It was well attended, and so many people came through that were like, well, we had no idea that there was help out there available, or that, people talk about this out in public. It's not like something you got to put a lid on. So that was a real plus for us, the event 2 weeks ago. Quinette, would you like to weigh in about the type of funding we do and the sort of different agencies and all that kind of thing?
Yes, that's what Bob kind of gave some background on the Community Mental Health Act, and I'll expand a bit on that. It is there under Illinois state law that the tax money is, we get to decide where that will go. So part of what the Mental Health Board does is we're going to go out, do needs assessment, find those gaps. And I like to look at mental health boards as, I'm going to butcher a Mother Teresa quote here, but kind of bring us, you're battered, you're sick, you're broken. That we are not a Blue Cross Blue Shield. We are not a Medicaid. It does not matter color, race, creed, your ability to pay. These funds are going right back into the community that I think it was like the equivalent of under $30 per household that went into taxes, that is going to provide thousands of hours of services, whether it's mental health services. It could be day programming for developmental disabilities. It could be employment services. It can be substance abuse, rehab, detox. It's the whole gamut of services that people do not have to worry about their ability to pay. That is what is covered under our funding. So currently we are providing funding through 22 providers in the community. Bob highlighted that we were very fortunate to be able to use, set aside 1.7 of our $2 million budget to go right back out into the community and keep our overhead low so that there isn't all those administrative costs to actually ensure that these programs are happening right there and creating access in the community. So I think that's the biggest thing I want to highlight, is that's how your township can support you and your mental health needs. Is I'll make sure that my information gets shared, that if you need help navigating, if you need to know our funded providers, where you can go get access, then we can also help coordinate that and ensure that you're getting a smooth transition and link to the right providers that you're looking for.
It kind of goes with our mission statement. Our mission statement is to promote affordable access to treatment, prevention, and services related to mental health, developmental disabilities, and substance use disorders for all Schaumburg Township residents through leadership, education, and funding. Our long-term vision is to witness Schaumburg Township residents with mental health concerns, developmental disabilities, and substance use disorders experience significant improvement in the quality of their lives. Our core values, three things. Number one, accountability. Be responsible to and a reflection of the residents we serve. Number two, good stewardship to ensure grants awarded have maximum impact. Number three, inclusion, so that age, race, ethnicity, language, gender, orientation, stigma, or finances are not barriers to assessing mental health care in Schaumburg Township. So that's what we're about. That's what we're going to accomplish.
Wonderful. Thank you for the general overview. I do just want to provide a reminder to the attendees that there is a Q&A, and you can use that to ask questions of our panelists. We have some prepared questions as well, but please feel free to add to the Q&A there, and we will get through those as we go throughout this evening's discussion. But yeah, please feel free to add that. Thank you guys very much for the general overview there. I believe we do have one question already in from Kathy. Can one of the speakers give 2 to 3 examples of the types of services they have funded and who the funding goes to? So I know you mentioned there's about like 22 providers. So can you give a little bit more detail of some of those services through them?
Yes, that's what one of our big providers is Kenneth Young Center. That's what they do, mental health, substance use. They have services specifically for like LGBTQ, even youth programming. We have Wings that is focusing on domestic violence. We the SHARE program that is also focusing on substance use treatment. We have 2 police departments that are doing a lot of community-based efforts and are doing like Schaumburg PD. They have a quality of life department. They just started, so our funding has helped supporting some of those efforts where they now have a mobile response unit. They have officers that are dedicated to going out into the community, and they're able to provide services right there at the police department. I know those are a few that come to mind.
For the developmental disability families, we have 2 right off the top of my head, Clearbrook and Little City. And those are big agencies that provide a lot of services, housing, day programs, therapies, and job coaching. And then there are like there's a joint venture between NWSRA, which is the local, basically park district for people with developmental disabilities, and Clearbrook have a joint venture program for day programs called Pursuit, and a lot of our residences, young people do that during the day. That they're not quite ready for employment, but boredom is a big enemy, and having some fun things to do and activities are a big help for the receiver and also a big help for the families. And so there's those as well.
Yeah, I mean, Boys and Girls Club. I will also highlight NAMI. I think they were here last week, you said. They are another all-volunteer organization that's doing a lot of great things. We have several.
That's great.
Well, we can find services for anyone.
Wonderful. So I know you specified that part of the programming and part of the funding is to make sure that people who come to you for assistance don't have to pay. So then typically then for someone who is going through like a mental health crisis, or would they go then through like your group specifically, or like the township, or do you recommend them to one of the providers that you're currently funding, or what does that route look like to ensure that individuals get the help they need and not have to like pay directly because they're paying through their taxes?
So we are not direct providers.
Mm-hmm.
And we will not be direct providers. But instead we grant money to nonprofits that are providers. So the money that we grant to them is so those providers can offer some free services. Now, some of these providers take insurance. Some take various insurances, some take government insurances, some don't. But they're all expected to do some care work for people that can't pay.
Okay.
And that's
understood.
That's the gap we're trying to bridge.
I'll highlight specifically though on crisis that yes, I would not recommend calling the mental health board in a crisis. I recommend 998 CARES line. Those are both options that the local provider, if for crisis services, is Kenneth Young Center. And of course, there are the local police departments that have, they can also help intervene and get connected. They both have setups for living rooms where they can help divert those appropriately.
Yeah, no, thank you for clarifying. I also had another question I wanted to touch on, something that Bob mentioned earlier, that part of your job is finding, is doing needs finding and finding where there are shortcomings in providing that support. What does that process look like for you guys? Are there certain areas where you send people out? Do you do surveys? What does needs finding look like for the mental health board?
Great question, because our first needs assessment was actually sort of a conglomeration of at least 3 different efforts. Harper College provided some professional work and facilitated, I believe, 9 focus groups for us. We had people out interviewing, and we had an online and paper and online questionnaire. And it was interesting. So we were new, and we were like trying to feel our way through this. And while we did, we found out that we actually were pretty accurate, because the Village's Schaumburg Nursing Division did a needs assessment last year, and I attended their rollout of theirs, and I was like, wow, we all kind of came up with the same results. And I was really proud of how things came together for us. But the same things are identified. The reasons for people to not get care, I touched on a few before, the money and stigma, but language is a big one, huge in our township. I learned that, I found this just amazing. District 54, our elementary school district, all their publications now are in 17 languages. So now there's discussions at the township, how in the world, we put out, there's a newsletter, we don't, but the township does. How do we reach all these people that don't speak English, or even maybe the more common, like the Spanish or Polish, because those are big communities. So how do we reach all these people? And it looks like what may happen, or what's being discussed, is a QR code on a publication that would open up just about every language. And that wasn't my idea, but I think it's a good, brilliant idea, and hopefully that make that work. But back to the needs assessment. So I attended some other entities' needs assessments and was pleased that we got it pretty close, very similar results. One of the things that we do want to do, probably next year or the year after, is another needs assessment. And we belong to a statewide association of mental health boards. And we're getting the same recommendation just about from every direction, that Northern Illinois University does needs assessments for mental health boards, and they really are thorough and accurate. And we may do that in a year or two.
Gotcha. And then so once you do this need finding, right, and you get this information, and then as like the mental health board, what do you do to then fulfill those needs, right? When you're looking to add more providers, what are the types of information you're looking for? Like, let's say the Hispanic community is underserved, right? So how do you fulfill that need? Like, what is your process?
That's part of what I do, is that I am the one that is boots on the ground, kind of doing those day-to-day tasks for the board. So I'm looking in the community, what providers are out there already offering free, low-cost services? Can we help fund them further to increase those services and their ability to serve more? Then, I mean, that's the biggest part, is then meeting with those providers and seeing if we can expand our network to create more access and just a better range of services.
And then so essentially then how do you incentivize providers to come into the area as opposed to going into a different township or anything? Or is that just the grant money, or what are those discussions normally like?
Well, there's two pieces to that answer.
Mm-hmm.
It's great. It would be great to incentivize someone to come into the area, but in order for the funding to be qualified, they have to be able to document that the funding was on residents of the area. So someone would sort of have to transition in baby steps.
Gotcha.
But there are probably providers in our area that we're not aware of, and they probably weren't aware of us the first year either. So it's kind of the build it, they will come thing. We anticipate more applications next year.
Do you ever do you have providers then who come to you who say, hey, we have we know we get this many calls from this area, we'd like to be part of your network? Or possibly, like, do they have any burden of proof to say that this is a need here? Like, do they provide their own data in any circumstances?
A bit. That's what part of the application is, that they need to clarify, I mean, how many are they serving? How many of those are residents of the Township of Schaumburg? So they do have that reporting that they should do on their application. And then they're also able to provide a projection based off that funding request that, okay, you may be serving 10. If you're requesting this funding now, you can serve 50. So they are able to put that information, and there is some additional stuff that goes into their application packet where we're able to review. We're also able, under our contracts, that we can go out and verify at any time that residents actually are receiving these services, and that we aren't just giving them money and they're sending back a paper that says, well, we serve this many people. We are able to verify those services are being rendered.
Okay, no, that's great. And I have one more question in this line of thought. So then you have this avenue with providers, you have your own, data gathering process. Is there an avenue for residents to reach out to say, like, hey, I live here and I suffer from this, and everybody else, like, let's say I am a hoarder, right? And I know my family who all lives here also has their own hoarding situations. Like, is there an avenue for residents of the township to like submit to, or like a kind of application themselves?
That's what, anybody could reach out to me at any time and let us know that, hey, there's this unidentified need. The other thing I want to highlight is the mental health board. We are required under the Open Meetings Act, we are conducting business for the public on behalf of the public. So we have open meetings. The public can come in and make public comment at any time. And that is a great opportunity for people to come in and highlight in front of the board, not just to me, but to the full board, and highlight their stories, the barriers they have witnessed, experienced with their family, friend, and highlight those gaps. And I know I've seen boards take that very seriously when presented with public comment.
Great. So both public and then through more private means. I would guess that I would hope there'd be private means, since there is stigma with mental health, people might not be willing to get in front of a board and speak on that. But that's good that there's both routes. We did have another question come in. Since the board has started, what changes have you seen in the community due to the work you are doing with the board? Since I think 2022 is when it started, right? Bob, maybe you can speak to this. I know you just joined. Go ahead.
As far as it changes from impact on funding, it's probably too early to tell.
Okay.
And the majority of the agencies that we are now funding, the township was funding previously. So there's history there. What we're trying to change are two things. A, awareness that we exist. So for two reasons. So we want any agency that's unaware of us, that thinks that they could provide services that are coming up short, we want them to make proposals to us. The second and bigger thing is, even though we were put here by ballot, sadly, the number of people that vote is not really indicative of the number of people that live here. And so the awareness, of public awareness for our board, that people would know that they could reach out and to us and say, hey, I got this or that going in my family. Where do I even start? And we're like, oh, well, you have developmental disabilities. There's a couple agencies that do that. And you have somebody that's presenting some serious mental health issues. Here's some agencies that might be able to get a diagnosis and help you get some medication and some counseling. Like kind of a clearinghouse, even though we will never be the provider. We want to be an informative agency to the residents.
That's excellent. And I know you mentioned there were a couple of, you had the mindfulness event here at the Schaumburg Library, and we're also very happy to have you speak with us today as part of helping with awareness of your board. Are there any other like outreach type of events that the board is planning in any specific type of locations, and is there a reason why you would select those for future outreach?
We were just asked to participate in one recently, so there is going to be at Harper College in a couple of months a huge Juneteenth celebration, and they're expecting 800 or 900 people to show up for that. And we've been asked to come there if we would want to, and we eagerly accepted to pass out information about our mental health board. And this is one of the segments of our population that did not respond to our needs assessment. And there's several groups like that just did not respond. So our job is to get out there and let them know, hey, we're over here, we're here to help. And the other thing is, we're not like nobody has to really give us their name or anything. If they want to be anonymous and come in and, tell us they're somebody they're not, but just lay out a problem and what do you do with a problem like this? We'll direct them.
No, that's a good point. I was going to say, I don't, if anybody's ever collected census data, people are very cagey about just, yes, I live here, let alone I'm having trouble and I live here. So, no, that's great to know that yes, you can share it anonymously. And one of the things that I had a follow-up question on is you talked about making sure that there were no redundancies. Since you guys are serving several different cities, how do you identify a provider that doesn't already kind of overlap and align with a service that's already in a specific city, but maybe not in another one? What does it look like navigating that type of technicality?
Well, let's see. We can't really look at it like cities because it's a township, but
Mm-hmm.
there is bleed over. So I'll just give an example. Just Roselle is in 2 counties. Roselle is in 2 townships. So the part of Roselle that's in Cook County is in our township, and the part of Roselle that's not is in DuPage County and in Bloomingdale Township. Now, that's the majority of Roselle. It's a minority part that's in our township. But their police are back and forth both places, and their fire department's back and forth both places. And it seems like for the most part, the agencies that serve us, a lot of them serve the surrounding areas as well. There aren't too many that are so exclusive, they're just in one township.
Okay. So then what kind of redundancies are you trying to avoid when you're, supporting providers and gathering this type of information?
For me, this is an easy issue to avoid, and it's not one that needs a lot of attention because there is always a greater need than there is money or services. So it's hard to really find anything that's like, oh, wait, we should avoid that because we have too much of it here. So, I mean, really, it's a minor problem because we have such a problem with there being such a need right now.
Understandable. Never gonna have too much support. No, that's great. Fantastic. So it sounds like with the breadth of services that you guys offer, right? And you said that there's overlap between the two of them, between disabilities and mental health and substance abuse. So what would be like? What is the majority of of those providers? Is there a greater percentage? Like, what does the breakdown of that look like in those 3 categories?
I didn't bring my sheet with the breakdown. That's what it is. Majority mental health services, and the smallest portion is substance use.
Mm-hmm.
So I would say it's over 50% is in mental health. And then we have a pretty big chunk that's developmental disabilities, and the smaller chunk is substance use services right now.
Yeah, I agree.
Yeah,
that's one thing I'd like to throw out about developmental disabilities. When a family is blessed with a child with developmental disabilities, first they're like, what do we do? You love, you nourish, and they start to grow, and now you need services. Unfortunately, there's no playbook for these people. The schools, you would think, might be close to that, but it's not great, the information that they put out. Or it's not enough, I put it that way. They put out good information, not nearly enough information. That's the type of thing, if someone called and talked to one of us who lives that world and has already navigated the school districts, already navigated guardianship, already navigated psychiatric care, we could be really helpful. Just information, just telling our stories. Here's 4 agencies out there that you're probably going to need to connect with in the next 10 years. That's not written anywhere. I don't know why. Same thing with, I'd like to add one thing about mental health too.
So then if that's something like you're identifying that that's something that's not quite there, is there a way, so do you have would you be able to work with this school system or one of your providers, right? I know you guys provide funding to the providers, but do you provide any other type of support or needs, or like can they make informational can they make a brochure on what to expect when you didn't expect a child with disability type of how-to guide? Or I don't mean to be crass on that front. I just that's it. Can you have that repertoire with your providers to add that extra step?
We have providers right now that are diligently working to try to get into the school districts and get them to cooperate. And it's a hard door to open, but we're working on it. It's very important to us. And the schools the districts do wonderful jobs on many counts, but then there's a point where it ends. So right now, if you have developmental disabilities in the state, you stay in high school and basically transition program until after your 22nd year of age. And then what? Back to the house, sitting there bored, nothing to do. Parents can't work because the person needs supervision. The day programs are all overcrowded. And if somebody is capable of working right now, it's impossible to get a job coach. There are agencies out there that specialize in picking that up from that age and doing job coaching and helping these people get some sort of employment. We're trying to get the school districts to cooperate, not to let us come in too early, but to work to transition out of that to the next thing. And hopefully we'll get that done.
So if I'm understanding, then so the board then kind of works as a like a mediator with your providers in the school system, as you guys are part of the township, or what, unless I've misunderstood.
We are funding some agencies that specialize in that sort of transition work, okay. And they're trying to get the school districts to let them come in a little before they turn them out the door, make the transition smoother.
There's a provider doing like consultation work with schools that since they have their foot in, schools are notoriously very difficult to get in, especially like as mental health boards or just outside providers. They kind of have their regimented way of doing things and their policies in place. So it is not an easy territory to kind of break down that barrier and get in there to kind of do collaborative work. So we are fortunate to have someone who applied who is doing a lot of consultation work locally with schools, and it has a local school they're getting into. So we're hoping that that grows throughout this year and a lot of good work can come from that.
I see. Okay. No, thank you for elaborating. So then along with it, does the board do, I know when you said you have these outreach events, right? You go and you outline, this is what you can do in these situations. These are the providers that are available. Do you have any in-person routes or like a database or a library of like, these are the resources available like via a website or other means like that?
Not at this time, but it is one of my brain children that I'm wanting to develop here very soon. Just kind of that service directory of our funded providers or even just other local, low cost, free services that residents could go in directly to that and see. They serve individuals that reside in our township, and this is kind of the layout. This is the services they provide, and this is what you can expect to pay, not pay, or the insurance is accepted. So that is to come. I will make it happen soon.
Yeah, no, I know it's really hard, especially with limited staff, and especially when the scope is so big. Are there any plans to maybe work with specific like local governments? Because I know very often on city websites, they'll have a list of like community services and this and this. Like, is that something that, you guys plan on undertaking by yourself to make this list, or maybe working with one of the local municipalities? Or if I know you said it's one of your brainchild, but if you could elaborate on any potential routes that you guys may go for that.
I think I would definitely want our township to have it on our website, and then I will blast it out to anyone willing to put it on their website. That I think that is one of the biggest things is people need to know where to go. And for me, that is a no wrong door approach, that I don't care where they get the information. I don't care if it is the bathroom stall at the local bar that they see this is a provider they can access, or if it is on the library's website or the township website, that people just need to know where they can find these services. And that is a lot of times that first initial barrier, that when people need services, it is overwhelming to try and delve into that and find services and just navigate that territory on your own, or even with a support system. That making that first appointment and showing up to that first appointment are the hardest things. So being able to, plain and simple, here's the information, these are the resources, that is a huge first step in just getting that out there.
Okay, thank you. We did receive another question. It was mentioned, accountability was mentioned. How does the agency provide information to show they used the funds for under budgeted programs?
That's what, well, through their application, and then monthly, when they are making a request for that monthly chunk of their funding, they are reporting on number of residents served and the hours served, or the service hours provided. So we're able to kind of keep a pulse on that and ensure that there isn't underutilization or overutilization of their funding award. If someone is going wild and able to provide a lot of services and create that access, they could always come back and request more funding from the board. But that's also in our contracts. We can go out and do site visits. We can go out and we can request to see the finances that our providers agree to opening their books and ensuring that we can check that. We can also check client files to ensure that that documentation is there to support those services. It's essentially, we operate like a third-party payer that's similar to insurance. If insurance wants to see all that documentation, they can request it. We have the ability to do the same thing. Our providers also do quarterly reporting, and then there's financial reconciliation that they'll have to go through at the end of the year to ensure that any funds that were provided and not utilized should be returned.
Thank you. So then, if I'm understanding correctly, it's essentially based on their reporting of and then if you want to confirm if that's true or not, you can go out and do like a kind of an audit, essentially.
Correct.
Okay, great. I know you mentioned one of the big things that you guys are working towards is, visibility of the board. We do have, folks here. What would, if you were to provide like a call to action, for mental health awareness, what can we do as active, civically aware individuals to make, like, what would be impactful for the board, for us as individual citizens to kind of spread the word? Are there any type of like specific, communities or areas or other services you guys are working with? How can we spread the word, I guess, is my question.
I think my response is anytime you are in those conversations surrounding mental health, substance use services, just mention mental health board, and I am willing to bet my life savings that someone's going to look at you and say, what is a mental health board? I've worked for two, and I can probably count on one hand the amount of times I've said I work at a mental health board and someone knows what I'm talking about. So I think it's just a matter of even just saying it and waiting for that question of what is a mental health board, and even just having that one snippet of they provide funding to community-based services to create access right within that same community. That goes a long way.
another question. And feel free if there's any more detail you want to go on any of these, feel free to jump back to them. I'll just keep rolling them out as we go. But with all the providers you're working with, are there any that are on more of the preventative side of things? I think in the past couple of years we've heard lots of news reports about a loneliness epidemic, right? Which is I consider to be a mental health issue, which then leads to other physical health issues like heart attacks and all these other things. Do you guys work with any providers on more preventative things and community engagement avenues, as opposed to just not just, as opposed to, more like psychiatric help type of items?
I know the one that comes to mind is NAMI. They run their totally anonymous support groups where it's not treatment, it's peer ran. It is someone that you're not going and sitting in a room on a couch. I know they are a big one. There's I know Kenneth Young Center, they have their living room opened up now where it's a little more preventative, where they can help navigate services there, opposed to it being a bit more clinical in approach. I know those are two I can think of.
Schaumburg Police Department has the same thing now. It's just about up and running, if it's not already, a living room situation where people can go to the police department and they have a very, inviting, comfortable environment that people can go in and just chill out. Especially if homeless people can come in there. But they have social workers on staff. The police department does. They do a wonderful job, and somebody to talk to. Another thing, in mental health crisis situations, any families that have ever gone through this with a family member find some real gaps. First of all, it's almost impossible to get a bed in the hospital. And then if you get past that, if you needed like a 10-day treatment, 2-week treatment or whatever, that's the next big hurdle. I mean, people can end up at a hospital right here in the community, and with a teenager that needs to go into a program for a couple of weeks, and then the closest programs in southern Indiana or something, but they're all around here, but there's no room. There's just wait lists everywhere. But the big deal is wait list to see a psychiatrist. If there's any people out there in that field listening, here's a plea from me. I'll start with a story, but end with a plea. A lot of psychiatrists don't accept any insurance at all. They don't have to, because their executive clients would not want any record that they're seeing a psychiatrist. Other psychiatrists just take, top shelf insurance, and almost none take Medicaid. I'm sure there are psychiatrists out there that have a big heart and do some free things, but there just isn't enough. So when a person has a mental health crisis and they need to see a psychiatrist and they need to get on some meds right away, sometimes right away is weeks. And that's dangerous. That's dangerous for them. That's dangerous for the whole community. There's a big gap there. It needs to get filled somehow.
Does your group, especially with these, distance issues, do you guys explore any like telehealth options or telepsych or therapist type of virtual options?
Well, again, we're not direct providers, but
yeah.
I'm really sure that some of the agencies that we fund probably offer that.
Okay, as a subset of one of the providers that you work with. Okay.
And that's what a provider does. If someone's doing telehealth, they do not need to be in the community. If they will serve Schaumburg Township residents through strictly telehealth, and it creates access and breaks down another barrier, because that is another huge one, is transportation. Notoriously comes up on needs assessments, because once you get out in the suburbs, public transportation is just awesome, as we all know. So that is a huge barrier. So I know if telehealth providers were to reach out, That's just one of the things that gets checked on our application is, do you serve residents for our township? And if so, you can be considered for funding.
Gotcha. Okay. And it looks like we've got one more question here, and we got about 5 minutes left, so we'll answer this one. So will the MHB come to speak to different groups of people to make them aware of what the MHB is doing? I know you mentioned you have a potential Harper visit up, but do you have plans to go to these specific different groups in the future?
We don't have plans to seek that out at this point. However, we've responded to those types of requests, and yeah, we'll gladly to go talk to anybody that wants to listen.
Yes, call us. We will come.
Excellent. But I thank you so much for all of your time and answering all of these questions today. I know we have quite the gauntlet, so thank you so much for your expertise and your time and talents. I do just want to say also thank you for all the attendees for coming. If you are interested in more of the Civic Awareness Series, our next one is actually a hybrid version on Tuesday, June 11th. It'll be a panel discussion on equity, diversity, and inclusion. The on-site portion will be at the Trickster Cultural Center, or you can join us here on Zoom for more discussions on being civically involved. Once again, thank you so much to both of you from the Mental Health Board. Mental Health Board, those are the big 3 words. Tell your friends, tell your neighbors. And I will pass it over to Kathy for any final words from the League.
Yeah, the one thing we didn't talk about tonight, and I know that many of those of you who are in the League of Women Voters Palatine area, particularly Palatine, Barrington, we don't have a mental health board yet. There is one for Wheeling Township that covers Arlington Heights, and I think Buffalo Grove and Wheeling and some other areas there, but Palatine doesn't yet have one. But I believe that NAMI and some others are currently going to develop a plan, or they may already be out there trying to get signatures on a referendum to get Palatine Township to get started on this effort. And so I'm encouraging that you look out for that, or if you should see someone, these are really important community resources to support. And just wanted to make you aware that if you're on the call and you didn't hear anything about Palatine, get behind it, because it's the only way that it's going to get done. So aside from that, again, thank you all of us to all of you for joining, and those of you who may have joined and are not members, if you're thinking about joining the League, please reach out to the League at lwvpalatinearea.org, and we would love to have you as a member. Thanks.
I think that about wraps it up for this session. I do want to quickly say, Janet, when we initially had gotten this all booked, we didn't know exactly who our panelists were for the DEI program in June. So I just want to give them a quick shout out. It's Gina Roxas, who's the executive director of Trickster. And the Trickster is where Governor Pritzker signed the bill for Native American heritage and history being taught in social studies classes in Illinois schools. LaShawn Ford, Representative LaShawn Ford is going to be on the panel, and there is a representative from PFLAG. So we have a wide array of speaking about LGBTQ and African American, Native American, and so on policies and getting those passed. So I'm very excited for that. And one more big thank you. It's been an absolute delight from a library perspective to get to work with the Mental Health Board so closely this month. I've greatly enjoyed working with them and getting to meet Bob and Quinette. And Janet, thank you so much. You are, as always, an absolutely amazing host and guide. And Kathy, thank you so much for agreeing to partner with me and allowing the library to work so closely with the League. It is an absolute delight. So until next month, remember it's second Tuesday of the month. I'm really excited to be in person with you guys next month. It's been virtual for so long, but now that the library renovation has come to its conclusion, we'll be able to all be together again. So until next time.